From the JAMA Network, this is JAMA Internal Medicine Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Internal Medicine.
Hello and welcome. This is Dr. Eve Rittenberg, the Viewpoint and online editor at JAMA Internal Medicine. So today we're talking about how cannabis affects the health of people who are pregnant. With marijuana now legally available for recreational and medical use in so many states in our country, concerns have been raised about the harms that cannabis might pose to fetal development, but not as much is known about how it might affect maternal health. And so today we'll talk with two experts on this topic. Dr. Kelly Young-Wolff is the first author of a study entitled Prenatal Cannabis Use and Maternal Pregnancy Outcomes. Dr. Young-Wolff is a licensed clinical psychologist and research scientist at the Kaiser Permanente, Northern California Division of Research. And we'll also hear from Dr. Jamie Lowe, who co-authored the commentary, Association Between Prenatal Cannabis Use and Maternal Health Outcomes. Dr. Lowe is an associate professor in the Department of Obstetrics and Gynecology at Oregon Health and Science University. So welcome to both of our guests. I'm so glad you could join us. Kelly, I would like to start by asking, why did you decide to study cannabis and maternal health?
Yeah, thanks so much for having me here. We've been studying prenatal cannabis use over the past decade or so, and we've been seeing real increases in rates of prenatal cannabis use and increases in use of cannabis daily during pregnancy. And we've been learning more about why pregnant individuals are using cannabis and hearing that they're using to try to cope with mental health symptoms during pregnancy, like depression or stress, and trying to self-medicate symptoms of nausea and vomiting in pregnancy or morning sickness. And there's growing evidence showing that use of cannabis during pregnancy is associated with increases in adverse neonatal outcomes. So things like lower birth weight, preterm birth, admission to the neonatal intensive care unit. And there's some evidence that people who use more frequently are more likely to have these adverse neonatal outcomes. But our team was really surprised by how little research has actually focused on the association between use of cannabis in pregnancy and maternal health outcomes. And so it's this gap in knowledge that we were really hoping that we would be able to address with our study.
It's so interesting to think about cannabis being used intentionally as a treatment for some of those symptoms that people are doing in the absence of some of the evidence, as you talked about. I'm wondering how you were able to start to tease apart some of the causes for the adverse effects that you saw, or what the pros and cons of using cannabis during pregnancy were, sort of how you went about that.
So in this study, we attempted to address this issue by adjusting for a large number of psychiatric and medical conditions that are associated with prenatal cannabis use that might also be associated with these adverse outcomes. And so we used data from our electronic health record and tried to account for differences in those conditions and then see if we still find these associations after these adjustments. So that's one way that we tried to account for knowing that individuals are using cannabis for a variety of different reasons. And then, not as part of this study, but in the past, we've done focus groups with pregnant individuals and just learned a ton from them about why they're using. And many of them really perceive cannabis to be safer than the prescription medications that their physician might prescribe to them. And so are really intentionally trying to do sort of their own harm reduction by using cannabis over some other things. And so I think that's really important to know as you have conversations with patients that most of the time, pregnant individuals are really trying to have a safe pregnancy and have a healthy baby and sort of doing the best that they can with the information that they have.
And so in this environment, what were the most important findings, do you think, from your study? What did you learn?
Yeah, so we found, using data from Kaiser Permanente, Northern California's large integrated healthcare delivery system, with universal screening for prenatal cannabis use, both by self-report and urine toxicology testing. Cannabis use during early pregnancy was associated with greater risk of gestational hypertension, preeclampsia, gestational weight gain both below and above the recommended guidelines, and also greater risk of placental abruption. We did not find an association with greater risk of eclampsia, but it looked like there was one. It just did not reach statistical significance, and that might have been in part just due to how rare that outcome is. And then we also found that prenatal cannabis use was inversely associated with risk of gestational diabetes. We have data on frequency of cannabis use as well, and we found evidence for a dose-response relationship between the frequency of cannabis use in early pregnancy and risk of gestational hypertension and preeclampsia, so that the risks were greatest in association with daily cannabis use during early pregnancy.
And were those findings things that you expected to see? I'm thinking particularly about that inverse relationship with the gestational diabetes, which, sort of stands out from that. Was that a surprise or something you can explain?
The increased risk that we found with these other outcomes was what we were expecting. With gestational diabetes, it does seem a little tricky. Very few studies have looked at this association before with prenatal cannabis use and gestational diabetes, but there have been 3 prior retrospective cohort studies that actually found similar results with cannabis use related diagnoses in pregnancy and lower risk of gestational diabetes. So we're not the first people to show that, but not all the studies have been consistent. And so we were looking into this further, and it does seem like there was a meta-analysis just of adults in the general population that found lower risk of developing type 2 diabetes among individuals who used cannabis compared to those who didn't. So it is a very interesting finding, but not completely inconsistent with what other people have found before us.
So let's turn to Dr. Lowe. I was so interested by this idea that pregnant individuals are intentionally trying to reduce harm by using cannabis. I'm wondering if you could give us your sense of the bigger picture of what cannabis use during pregnancy looks like for pregnant individuals, what you might tell clinicians who are working with pregnant people about how to counsel their patients.
Yes, thank you very much, Dr. Rittenberg. As Kelly was mentioning, a lot of the patients that I talk to who are pregnant and also using cannabis have definitely shared that the most common reason why they're using cannabis is often for the first trimester nausea, vomiting symptoms, or insomnia, pain, and stress. The reason that they most commonly give for turning to cannabis is they were really looking for a more natural alternative to their prescription medication. And a lot of times I try to remind them that because cannabis is from a plant, other drugs like opium and heroin and tobacco and alcohol are also from plant sources. Trying to understand the reason for patients using cannabis is very helpful for providers to better address, I think, other options that have better safety profiles. For example, for nausea and vomiting in pregnancy, the first line recommendation by the American College of Obstetricians and Gynecologists is actually B vitamins, which is very natural, very safe, and something that I always encourage other providers to consider when patients do provide symptom relief from nausea and vomiting as the main reason for why they're using cannabis in pregnancy.
How would this study now change the way that you counsel pregnant individuals about their own kind of health consequences from using cannabis during pregnancy?
What's really interesting about this study is, as Kelly had mentioned, a lot of the evidence that's out there really focuses on offspring outcomes. And as a provider, it's really important to have more evidence-based safety data regarding maternal health outcomes when talking to patients who are using in pregnancy so that they have the most information to make decisions regarding their care and their baby's care. I think one of the most striking findings in this study that also aligns with some of the literature outside of pregnancy is the cardiovascular findings in terms of increased gestational hypertension and preeclampsia that was seen in this study aligns with some of the recent news that's been coming forth regarding cardiovascular disease mortality with lifetime cannabis use, especially in females, that has been reported. As a provider, I would include this in my counseling regarding the risks of cannabis use in pregnancy and that potentially there's increased maternal outcomes, especially hypertensive diseases of pregnancy that can then also impact placental development and health, which downstream can also be linked to some of the neonatal outcomes that we're seeing, including small for gestational age and preterm birth.
Do you have things that you're sort of excited about as next steps? I know in your commentary, Jamie, you mentioned some of the things that you were thinking about in terms of what research is needed, but I'm wondering for both of you what your sense is of the next step in this.
I'd love to add to what Jamie said about speaking to patients, because we've heard from a lot of our pregnant patients is that they know that cannabis use in pregnancy is associated with lower birth weight baby. That's something that a lot of people understand. And what we've been hearing is that they're not concerned about that. They're like, oh, if that's the only bad thing, it's fine because it will be an easier delivery. It's just the understanding of what that means in terms of health risks and later outcomes is not there. And so I think that hopefully the results of this study can be used maybe more compelling to pregnant individuals to help start to understand what some of the risks might be beyond lower birth weight, which doesn't seem to really resonate with them as a reason to stop using. So I just wanted to add that in there because I found it to be very interesting in talking to multiple patients who say, oh, we already know it's associated with low birth weight and that's fine because it means I'll have an easier delivery. So in terms of next steps, one of the things that I think is still a gap in the literature and that we're hoping to address with the new NIH grant that we got from NIDA is to better understand how different modes of cannabis use impact health for pregnant individuals and their offspring. So this is an area of research that's really been lacking. It's hard to keep up as all of these new modes of use come into play. And a lot of times we're not collecting the data that we need to evaluate those things. And so we were fortunate a few years ago to add questions about mode of cannabis use during pregnancy to our screening questionnaire for all pregnant patients in our healthcare system. So we're collecting information on whether their cannabis is smoked or vaped or whether they're using high potency products. And we're even looking at blunt use specifically, which is important because you get the combination of tobacco and cannabis. And so we received funding to examine how women are using cannabis in pregnancy. And I think then to take that next step to try to say, does it matter which mode you're using and how do the health risks differ depending on whether your cannabis is smoked or whether you eat an edible? And I think this is really important because even though smoking cannabis is still the most common mode, even in pregnancy, as far as we are seeing in our data, there's a lot of variability in terms of how patients are using cannabis. It's not just one thing. And some pregnant individuals are using multiple modes. I think it's something that's important as a research gap, but also something that our patients are very interested in understanding because they are asking, well, is there one way that's safer than another? What do the data show? And there are no data yet that really can help them answer those questions as they're making decisions about what they're going to do.
Thank you. Jamie, I don't know if you have anything to add.
Yeah, I think that the comment about the smaller babies is a really important one to highlight in terms of future gaps of knowledge. And I think that really blends into where I think the research gaps are is longer term outcomes in offspring. And one of those is actually looking at how do these findings that we're seeing immediately after delivery, how do they then translate to longer term outcomes in adolescents and eventually young adults? And one of the things with just small for gestational age alone is there is a higher risk for neurodevelopmental disorders and socio-emotional and behavioral disorders, as well as illnesses and other comorbidities, including hypertension later in life. And so I think part of that also highlights we do need to follow these offspring out further with longer term studies to look at those outcomes so that we can better counsel the patients so that they're appropriately informed with what does low birth weight mean in the setting of cannabis use down the road for my child later in life. I think future studies need to focus on examining the impact of co-use of cannabis and other substances so that we can really more comprehensively counsel our patients. If it's a augmented additive effect from both substances on adverse outcomes, then as healthcare providers, we can target our counseling to, if you can't abstain from both, at least try to cut back on using one or at least less of both if it's more of that dose-dependent effect that Kelly has seen in this most recent study. And also, I think we need more research on what potential underlying mechanisms may be involved leading to these outcomes that we're seeing, because then we can actually start thinking about targeted interventions and therapeutics that might mitigate some of these outcomes that we're seeing, especially in patients that can't abstain from using cannabis in pregnancy.
Thank you both so much. I really enjoyed this. Is such a directly relevant to clinical practice conversation, and the research that you're doing is so useful when we think about working with people who are pregnant as they think about managing their symptoms. So thank you both so much for being here and for the work that you're doing. This is Dr. Eve Rittenberg, the Viewpoint and online editor at JAMA Internal Medicine. Hope you've enjoyed this JAMA Internal Medicine podcast. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or wherever you get your podcasts. And thanks for listening.